Hey y'all, welcome to Vetted and Vet Med, the podcast where two African American female veterinarians pull back the curtain on the life and the world of veterinary medicine. I'm Dr. Wilson.
And I'm Dr. Levy. Join us as we dive into real conversations about mental health, career transitions, work-life balance, and the unique experiences we face as Black women in veterinary medicine.
So go ahead, grab your stethoscope,
and get your favorite cup of coffee or wine, and let's get vetted in Vet Med. So today we are going to be talking about our experiences in working in corporate veterinary medicine. And I know that, again, everybody's experience in corporate is different. And, we just happen to share some similarities. There will be no names mentioned. But again, it's about sharing the perspective, and then also, about being an advocate, for yourself, for others, and things that you might want to consider when you are faced with the opportunity with being, or working at a corporate clinic. So I will, this is definitely it's gonna be multiple parts.
Yeah. I just feel like this conversation, to me, even thinking about it, like just preparing myself mentally to have this conversation, I'm just compartmentalizing. Oh, well, this is a whole nother conversation.
Mhm.
This is a whole nother conversation because the experiences within this umbrella of corporate medicine is just like vast. I'm just like
Mhm, mhm.
mind blown. So no, I mean, I just think there are definitely some pros and cons. And to be completely transparent, and of course, if you know me, you've had this conversation with me most likely. Um, my cons are going to be a little bit more fresh because I am fresh up out of there
Mhm.
and gone about my business. But I mean, of course, there were definitely some pros about the whole thing. As I mentioned before, when I first started, it was in Midtown Atlanta. And at this particular hospital, it was owned by two veterinarians. At that time, it was still under the corporate umbrella, though, but they were doing it a little bit differently. And they gave me a chance when, I wouldn't say nobody else, but they took a chance on somebody who had no experience. So I don't know if I can say that was corporate so much as the people,
Yeah.
but I appreciate that wholeheartedly because it got my foot in the door. It's been a very long time because that was in 2008.
Yeah.
So 17 years of corporate medicine for the most part um, has been a journey. I learned a lot in those undergrad times. It was great preparation because I saw a lot of things before I got to where I was going. And then I could apply what I saw and put a name to it, put a mechanism to it, pathology to it. And it just, made things a whole lot more visual for me. So I was able to apply, which I think is one of the most important things about being a veterinarian is being able to apply your situation.
Yes.
So, um, just, having that experience and being able to kind of move through this corporation and all these different aspects like nursing, they had student program, they had the DVM externship, they had onboarding as a new doctor. Like I mentioned, then had the lead doctor position, and then I went to area chief of staff. I appreciate the movement,
Mhm.
and not being stagnant in one place. Um, Even if that's not something that you want to do, it's always good to have options.
Yeah.
So I like that aspect of it. It's, very much appreciated. Um, I think that having this conversation with Dex. For all you guys who don't know, Dex is my husband. So I'm it's kind of always weird for me to say my husband. I don't know. It's never been. It's
Uh,
always I know. So I'm just gonna call him who he is. To me, is Dex. Having this conversation is like, are you going to talk about this? Are you going to talk about this? But quite honestly, my experiences at mostly every hospital was exactly the same,
mhm,
which leads me to believe this was my con part of my issues with corporate medicine, was deeply rooted. It was a very much internal problem that was way up.
mhm,
Yeah, it was way up the ladder
mhm,
because there's no way that I got the same situation with the same result and the same approach with this. Just it was. I mean, by the time I got back to Jackson and experienced this situation, similar situation, I had PTSD. Didn't even realize it.
mhm, mhm, mhm,
Um, and this is probably one of those moments where I'm like, this is where it turns into another conversation, which we can save for another day. Because for those you don't know, veterinary medicine is one of those entities that have a very high suicide rate.
right,
So when I say PTSD, I'm not saying it lightly. I definitely talked to my therapist about it. Like, I experienced a whole lot of things. So, just being in corporate medicine, I had my experiences, met wonderful people,
mhm,
um, very knowledgeable. I mean, Fayetteville, Georgia was probably my most successful area of nurses. Like, hell, the CSC, I would trust them with a pet before I trust, I don't know, some doctors that I met.
mhm,
Quite honestly,
mhm,
um, the conversations that they would have with these clients, I'm like, okay, well, go ahead, go all in.
right,
Like,
right,
explain all the heartworm disease. I appreciate that. Do you want me to
yeah,
talk to them about that? Yeah, because I do have 30 patients to see.
yes, and
I
you
appreciate
conversation, that's a long conversation. Mhm,
Yes, it's a long conversation. I mean, and it's definitely something that always happens because you're in the South. You go to
mhm,
get your heartworm seeds. But um, I met some very, very good people, and some of them have been, lifelong. I'm still in contact with a lot of people that I've run into that I hadn't seen in 10 plus years, 12 plus years, and I still talk to them. We just had that conversation, but I've learned a whole lot. And even going to the conferences that they provided, that was a very eye-opening experience too, rubbing shoulders with certain people, and I'm just like, yeah, hey, you know, we in a, in a certain kind of, I'm like, okay, I like this, and just being able to take in all the information
mhm,
and how to apply things to everyday life and how to apply it to the positions that I was in. It was, I mean, it's life changing.
yeah,
It really is. And I wouldn't, change anything despite, how much of a con my cons are.
mhm, mhm,
Um, I had some experiences in which there were very derogatory language used in the hospital, and the way that it was always approached for me was that these people had these conversations, and I'm not somebody to sugarcoat anything. So I have never heard the N word so much
mm,
until I got into professional setting. I grew up in Mississippi,
right, mhm,
went to school in Alabama.
mhm,
I go to Georgia, in Fayetteville, Georgia, and that's when it's thrown around in this clinic like it was. I'm like, what what are we doing here?
yeah,
And then, the moment at first, of course, the first time was my initial shock because it was one of the nurses I had been working with. And so I had to I had to get her together real
yeah,
quick.
mhm,
No, ma'am, I'm not. somebody you think in no way, shape, or form have I given you that type of comfort to
Right.
ever feel like you can use that word in front of me. Don't ever disrespect me like that.
Mhm.
And so it comes up again, then I'm dealing with my boss, my line manager at the time, who, not for nothing, at that particular moment, stay with me because this
Mhm.
is something completely different
Mhm.
from where I am in Jackson. And she was also um, from our alma mater and skin folk. And she basically, I mean, after the third time, it wasn't the same person, it was different people saying this. After the third time, I was told basically my situation was not as significant as something she had experienced in vet school. This lady called her da 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 da. So it's not that serious. Like, why are you so up in arms about it? And at that point, I was managing my coworkers leaving. I'm left standing in this $1 million hospital trying to cope. I'm working 4 or 5 days a week and I need a break.
Mhm.
And so I can remember asking her for some time off. I I'm the kind of person I rarely go anywhere
Yeah.
in a sense where like I'm taking off. I try to always incorporate it into like time that I already have, designated for myself. And I mean, it's a terrible trait to have, just so y'all know.
I
It's a
know.
terrible.
I well, I had to be intentional about changing it, but I was the same.
Yeah. Yeah. I mean, that's why we told y'all don't work 4 or 5 days a week. That's
Mhm.
crazy. Like straight out the gate. I mean, if that's what you like to do, that's one thing.
Yeah.
But if it's something you feel like is for you to engorge yourself in veterinary medicine, it's just really not the way.
Mhm.
Not to do it. So I mean, I'm asking for this time off, and she's like, "No, like we can't do that. It's
Mm.
just you." And I said, "Oh, okay." After I've been, gaslit and experienced this whole thing, because there's also, I forgot his title, but he basically made it seem like, well, were some things said about other kinds of people in there?
And none of that matters. None of
Excuse
that matters. And I know times were different then, like, I think now that probably would have been, like, better received or handled,
Yeah.
but, regardless of that, it doesn't matter if that was a different experience than what she may have experienced during her,
Right.
at school. It's a situation that is uncomfortable to you, and I'm like, I'm sure there is something written in, like,
It's definitely in the handbook, girl.
some handbook somewhere,
It is.
where that is inappropriate, and I feel like that should have definitely been handled better,
Yeah.
especially if you're bringing it up, because that's uncomfortable to have to bring up to somebody
Yeah. I'm just like, y'all can't be serious right now. I'm like in this professional setting.
in a professional setting.
You're gaslighting me. I mean, it's expected out in the street. Like I can't tell you what
Right.
to do out in the street. That ain't nothing like I'm not your keeper. But while we're in this hospital,
Mhm.
like you mentioned, there are things in this handbook. There are things that some guidelines that we need to abide by. And if I bring it to your attention and then you gaslight me to make me feel like not only is my experience not as um
Severe.
denigrating as yours, or you know so much more heartbreaking, you also made me feel like I didn't stick up for somebody else when that's not what we're even talking about.
Right.
Because not for nothing, I go to bat for all kinds of people. Don't do that. Do
Yeah.
not do that. But that's not what we're talking about. If somebody of homosexual, transgender, because in let's be honest, like in Atlanta, you got all kinds of people in it.
Mhm.
All kinds of people are my friend. But if all of this is a real issue, then I'm sorry that these people, if they said something like that, they didn't bring it up, then I don't know what to tell you. But I'm bringing up my experience and how it
Yeah.
affects me. So, that whole situation, like I said, asked for some time off, didn't acknowledge my, stress at that moment. And I said, "Oh, okay. Well, let's go ahead and put on those 2 weeks in." And then it was, what what's happening? Like, are you okay? What's going on?
Mhm.
I'm out, girl.
Mhm.
I'm out. Um, can we try not to act like this is not a real thing and what you just did to me? Because in no way, shape, or form did I ever make y'all feel like when we had this discussion in this room with you, me, and whoever the person was at that time that deals with all the discrimination and all that kind of stuff. I forgot the title, but in no way, shape, or form did I make y'all feel like this was okay.
Yeah.
And very similar situation happened when I got to Jackson. Kept at different corporation. I thought, I mean, it started off as a private practice, but they had just been bought out by a corporation. And this lead doctor at the time, she made a comment about one of the Hispanic workers and said um, something about he was doing something, but she was gonna call ICE.
Mm.
Yeah, and I'm like, where am I? Like, what is this Twilight Zone?
Yeah.
And I mean, needless to say, we ended up butting heads at some point. That's why I only made that sector in my life 2 months.
Mm.
I
Mhm.
can't.
Mhm.
I can't. Moving on to back to the old corporation. I experienced a similar situation in which one of the nurses said something in regards to one of the customer service employees
Mhm.
and made a reference to him being Middle Eastern and not being able to understand what they're saying and all that kind of stuff. And now, granted, this is going to be all in the midst of my line manager not acknowledging that she is removing my need to be responsible for the doctors in the hospital, but yet in the same breath blaming me for the things that they're doing in the hospital. Um
Ain't
and
that
then hmm?
wouldn't that have been her job?
Uh,
Or because she was another doctor.
well, my line manager
Mhm.
was blaming me for the things that were going on inside of these hospitals that I was managing.
Okay.
Uh-huh. But she also took my autonomy away. Every time I tried to hold somebody accountable, it was like,
Okay.
no, no, it's okay. Just maybe put them on a PIP
That's
or have a conversation.
mhm, mhm.
Especially, and I'm talking about these are not situations in which the conversation, is needing to be had for a third time.
Yeah.
Um, Clients are upset, patients are dying.
Mm-mm.
Um, there was even an instance where one of the doctors put a live puppy who it was supposed to be one of those aborted spays
Mhm.
that she kind of managed to make it seem like I made her do when I was not even there when she had the conversation with the owner and she acknowledged she was going to do it. She tried to put it off on a new doctor that I was training, and somehow the sack opened. And from my understanding, from a very reliable resource,
Mhm.
um, he said that the puppy was alive when she put it into the freezer. And so, right. And so the puppy came back out the freezer and they were resuscitating it. And I'm saying all this because this was not a situation in which it was normal for me to be in. It's not a situation in which I should not be having conversations about disciplinary action, like in your records, all these things. None of this was allowed to happen.
Mm.
And at one point, Are we talking about quality of care versus your fear of letting these doctors go or having them get so upset that they quit? You don't want somebody who is actively killing pets.
Right.
Like I don't know how else to say it. Because there were a lot more instances because I mean, not for nothing, there was a Caucasian doctor. Um, she may or may not still be there, who is very judgmental about the area she's in,
Mhm.
and she always assumes that people don't have money. And there's a particular situation in which a pet died because of it. I saw it later, and it had a whole screw in its abdomen because she didn't have the conversation because she didn't feel like they had money.
Oh my goodness.
Yeah.
Watching I just watched a clip from a different podcast actually called Critters and Culture. And
Mm,
it was literally just a clip about the bias that
mm.
we sometimes have. And you cannot I'm basically just reiterating what that other speaker was saying, that you cannot judge people basically by the cover of the book.
Yeah.
Um, because you have no idea, and that's why you have to,
Not a clue.
yeah, I'm like, you have to present the same care, the same package that you would present to anybody, because at the end
Yeah.
of the day, it's about the patient. It's about the
Yeah.
and
Yeah. And it's
yeah,
about allowing somebody to make the decision that
make
they
let them
see
make
fit for their baby.
exactly. You
That's
don't
it.
know what they got.
At all. At all. Like, I mean, and you can even say that we still have a certain type of bias. I mean, it's kind of like human nature
Mhm.
because honestly, and you might not even be thinking about it. Somebody walks up and you give them this $1,000 treatment plan. They're like, "Go ahead."
Okay.
They say
Oh.
yes.
Oh, okay.
They
That's
say yes.
okay.
Yeah, and the bias can be created by somebody or having a day in which everybody's saying no because we have those days.
Yeah.
Everybody's like, "Nah, nah, we'll wait. We'll monitor at home. We'll do this. We'll do," and then you come back the next day and you like, "Oh, okay." And it's not necessarily a bias to what somebody looks like. It's just
Yeah.
a general bias now
Yeah.
because it's like nobody wants to spend any money because no
Yeah.
one has any money, and
Exactly. Mm.
that's not true. Not true at all. So, I just felt like I managed to move up to these positions in this particular position where I was excited about being able to contribute my knowledge to what I felt was um, a needed area. And I couldn't even do my job
Mm.
because you were fearful of losing doctors when in fact you're losing pets and clients
Mhm. And
who
that's
keep the hospital afloat.
yeah. Yeah.
And, I ended up in a situation where she started talking about me. Well, she would start making little comments. And of course, they get back.
It's always gonna get
They get back. You're my boss. You're my line manager. You're
mm,
somebody who also told me I was in your backfield. Meaning, for those who don't know, like I was supposed to be her successor at some point. She was looking at me to do this.
mhm,
If I'm supposed to be your successor, and these are the conversations and the things you're saying about me behind my back,
mhm.
how do you feel about the people that you don't like?
Right. Right.
That's concerning.
Mhm.
So again, I'm back at the inner workings of the company. It's coming down from somewhere because I'm getting the same, because it wasn't always like that. And I hate that because we're talking about, us being African American females in this role.
Mhm.
Another conversation for another time, but the grief that I felt getting these comments and this negative. behavior from women that look like me was like I was so hurt.
Mm,
I'm just like,
mhm, mhm.
you supposed to have my back
Right, right.
more than anything. You know, I I can't speak for everybody else, but as the 92%, like at that time, I felt like we were on the same wavelength. I felt like we had a commonality, and not just because we're a black female, but especially after, my education and what I've showed you and all those things, my work that I put in. After that, you supposed to have my back.
Yeah, yeah,
Like, if you're gonna have a conversation, have it with me first, because this is first I'm hearing of it.
yeah,
You
and it
feel this way?
betrayal, yeah.
Yeah.
I'm sure it felt
So,
betrayal in a way.
yeah. I mean, so I just had, you know, the start of PTSD in that moment, because after the young lady said the derogatory comment, it turned into a whole situation in which, well, she admitted. Now, this is her line manager, because it was a nurse at the time. Her line manager saying these things to me because after I got in they behind about approaching it, because they were gonna let it go.
Mm,
Yet again,
mhm,
why are we dusting this under the rug? We just had a doctor who left probably less than 6 months ago at this point, who is Middle Eastern. So what happens if he was there during that time? Are y'all not, like, let's put some things in perspective. So you're counting on me to have to drill this into y'all about the things that are in your handbook, the
mm,
discrimination policies, the things that make people feel like they can't be in the space
yeah,
and do what they love. So she was just like, she apologized, and you know it wouldn't happen again. And people say things in the again people say things in the hospital that. And so at that point, I'm like, she didn't say the N word. So how does it directly affect me?
mm,
So here I am bringing up another situation, but it's not even offensive to me directly
yeah,
in a sense where I am Middle Eastern, but it's offensive to me because you were talking about a group of people based off of who they are, and they can't change that.
right.
And they shouldn't have to.
Yeah, and all that creates a hostile work
Hmm.
work environment.
Oh, yeah. Yeah, yeah, and I start using those buzzwords. If y'all don't know the buzzwords, I start using those in an email.
Mhm, mhm,
Yeah. I start using those in an email because it was a hostile work environment. Because why would I want to work with her ever again?
mhm,
I
mhm.
don't. I don't want to work with her. She also, I mean, and I mentioned, just because she's apologetic, this is okay to move past this. And so it took a long time. I mean, she even had documentation, but needless to say, after I left, I, you know, at this point, it is what it is. But I went out on leave with no expectations to come back. She's now shift lead.
Mm. Did moved on up.
Volumes, speaks volumes.
Mhm. They don't care. I mean, it's just about trying to fit a body in. Yeah.
Mm-hmm.
And the other thing too is it's one thing being told, because I mean, has she ever even witnessed any of this herself, the line manager or whoever is in the position to, move anybody up in the hospital? Has she ever witnessed that?
Witness what part?
Any of like the derogatory comments?
I couldn't say that she witnessed that you know, in person,
Hmm.
but this was not this person's first offense
Yeah, yeah,
in this category.
yeah. And I
So,
think it should definitely, like, there has to be repercussions for, certain things and different levels of things, especially if it is creating, again, a hostile work environment. I feel like certain things are allowed to let slip by.
mhm.
Because I don't know if it would have been different if it was more sexual connotation.
Yeah.
like sexual harassment or anything like that, but it all falls into the same category,
Yeah.
with it making someone feel uncomfortable.
Yeah.
And I think it's hard for people to let people go, because of the fact that it's hard to get people back in, back in that role.
Yeah.
Understand, but at the same time, I just told I just told one of my supervisors the other day, I'm like, you, because he was feeling bad about having to let an employee go, but I'm like, you got to get rid of them bad apples,
Mhm.
you know, especially if it's just that one, because they're going to spoil
Yeah.
much. Um, so if that, person is now in a leadership role, still speaking like that, then that is creating a culture, for the clinic and for the
Yeah.
environment, because everybody else gonna feel like it's okay and that they
Yeah.
so talk that way, or there's gonna be other people that are uncomfortable that may not even have the courage to speak up or say anything.
Right. Because there is somebody of, transgender orientation in that hospital.
Mhm.
And he is somebody who is not going to necessarily speak up for themselves.
Yeah. And that's on.
What happens when, she harasses him?
Mhm.
What happens then? I said all this to say, I say, I keep saying, I said all this to say, I just, I think that with the cons of corporate medicine, it, it's not for everybody.
Yeah,
And I do think everything has an expiration date.
for sure. This will conclude. Oh, Lord. So
Ah,
this episode, and we'll be back with the next part.
stay tuned.